Uh, Shall we start? Okay. For the second presentation is more technocratical one. I'm going to present to you. No, we did that. Uh, I'm going to present to you. Yep. A personality questionnaire that I have developed. It has been developed in Greek and in English. The main problem in the personality questionnaire that actually exist are that they are quite large. Personality assessment inventory has 344 questions, and MMPI has 600 and something, if I'm not mistaken. I'm sorry, I don't remember the name now. So we have tried to develop a questionnaire that would be small and would try and find exactly the same things as MMPI, PAI, and the rest of the questionnaires that exist that are considered personality questionnaires. So, the personality behavior inventory, it consists from 195 questions. It's answered in a 4-point linked scale from not at all true to very true. The time of completion is 30 to 35 minutes. It's half the time of the next smallest questionnaire, which is the personality assessment inventory. The education level is the third grade. That consists also for the English version and for the Greek one. It's set to make diagnostic consideration based on DSM-5. It has critical items, which are some questions that we have found through the validation that are quite important even for treatment purposes. And we have a number of supplemental indexes for forensic work and safety evaluation that we are using in the forensic section, apart from the clinical scales that already exist. Here are the studies that we have conducted. We have a standardization sample, clinical sample, forensic. We used a number of Asperger syndrome patients and mental retardation, borderline to medium. And it was also used for employee selection and assessment. With the exemption of the developmental disorders and the employee selection assessment, all the other validations occurred on the English and on the Greek sample. Very briefly, let me outline a little bit the factors of the inventory. It has 8 reliability factors, 47 non-interacting factors, which means that one question goes to one factor. It has facts about emotional disorders, thought disorders, eating disorders, personality, addiction, addictive behavior, behavioral characteristics, and personality characteristics. It also has 12 interactive factors, which are questions that belong from the factor analysis and the confirmatory factor analysis to more than one factors, and we have 8 cross-evaluation factors. Those cross-evaluation factors are if a patient answers the inventory inconsistent, you don't throw away the results. So there are some protocols that adapt the results in a manner that can be used either for evaluation or for treatment planning or for whatever the use you want to be. We have here I'm outlining a little bit the different factors for the reliability. We have unpredictability, uncommonness from the first and second half and the total one. Negative and positive tendencies, defensive tendencies, and factor pretentious many times, especially in the forensic setting, we can have a patient who wants to exaggerate probably an addiction or a clinical symptom. That particular scale, including with a number of other factors, reduces the level of the results into a more realistic point, so we can make a more objective analysis. Most of the factors on that particular questionnaire have subdivisions, with the exception of obsessive compulsive disorder, phobia, post-traumatic stress disorder, and conversion disorder. Anxiety and depression are separated. As I have said before, I have a cognitive behavior background, so we have separated them to the cognitive section, which is the way of thinking, the emotional one, which are emotions that are associated with those disorders, and finally the activity subsections that are evaluating activities or lack of activities that are associated with depression and anxiety. Again, thought disorders, I won't bother you with the sub-factors. We have mania, paranoia, schizophrenia, and eating mishabits. Actually, I believe that it's one of the very few personality inventories that has questions about anorexia nervosa and bulimia. Most of the questionnaires, with the exemption probably of MCMI, present a tendency, and they encourage in order to do a more specialized test. Here you can have a diagnostic consideration also for eating disorders. Addiction. As we have said in the previous presentation, addiction is behavior. So the first and foremost, we designed a factor that evaluates behavior tendencies toward addiction, whether it is alcohol or drug problems, that we are including separate questions. We are also evaluating whether a person would be prone to develop any other form of addiction, from workaholism to non-suicidal self-harm to addiction to a person, to a relationship, to sex, to different types of addictive behaviors. This is my favorite part of the inventory, the personality disorders. We have the borderline personality disorder and the antisocial personality disorder. Those two factors are separated on 4 different sub-factors, which are considered to be the main identities of every single personality disorder: emotional instability, identity concern, relationship problems, and non-suicidal self-harm, which are the main characteristics of borderline. Each of those factors, sub-factors, can be evaluated separately and all together as a form of symptomatology for borderline. The same thing occurs also for antisocial personality disorder. And we also have 3 more factors that are usually used for forensic purposes, and this is sadism, psychopathy, and we have a confirmatory also factor for psychopathy. We have 3 factors for medical problems: myoskeletal problems, heart and chest, stomach and abdomen. Those 3 parts are the main health concerns that someone would face on a clinical setting of not pathological setting, but in the office of a psychologist or a psychiatrist. And that's why we have decided to evaluate those 3 that are separated from symptoms that could be associated, for example, with a panic attack. So they evaluate clearly and only pathological symptoms that are not associated with any psychological disorder. We have the psychosocial factors, which is lack of support. It's social support, but on the other way around, the perception that a person does not have enough people, or the people that he or she has in his life are not adequate enough in order to help him in everyday situation. And we have the everyday stressors that includes problem in family relationships, economical problems, problems concerning the nature of working condition, and important changes in life that are difficult to cope. We have the behavior characteristics. We evaluate hostility, suicide tendencies, hopelessness, and acting out tendencies. The acting out tendencies is this impulsion that a patient can present, not only borderline, but in different disorders as well. So we decided to create a different factor that evaluates that, because those particular patients have a higher risk in order to harm themselves, and it's very useful for a treatment setting. Apart from that, I would like to mention the suicide, the hostility risk evaluation and the evaluation for suicide possibility, which are two factors that are not associated with suicide tendencies or hostility directly, but they evaluate whether a person is prone to that, to those particular behaviors, even if the other factors are low on their results. And we have the treatment refusal. It's very useful in clinical setting, because analyzing this particular factor, we can see where a person can have difficulties during the treatment. And finally, we have the personality characteristics that includes assertiveness and empathy. By empathy, we mean we measure if the person is interested in other people's problems, and is not cold or unemotional. Here's a comparison between PBI and MMPI. 567 are the items in MMPI 2, 195. You can see PBI can be completed in half the time. It has more factors. It creates a diagnostic evaluation based on DSM-5, and one thing that we are particularly proud of is that we have separate questions for forensic, clinical, and personnel evaluation. It's something that we find very helpful in the evaluations that we are conducting. Again, very briefly, this is also the comparison between PBI and the personality assessment inventory. Again, it's smaller, and as you can see in this comparison as well, PBI, even though it has less questions, it has more factors. I didn't know that I had that much time, so I would bore you with some statistical findings as well. In the validation that we have conducted on the different sample, we found in the factor analysis and the reliability and internal consistency quite high results on all the factors. This is a project that we are conducting the past 10 years now. So in conclusion, PBI is smaller, faster, better because we have designed it, so we are quite proud of it. It can be used, it has been used in non-clinical, clinical, forensic, and public safety and personnel selection. If you have any questions or you require a sample, you can contact us, and we would be happy to send it to you in order to evaluate yourselves. Thank you very much. If you have any questions.